Welcome to this deep dive, all about eye health
Mm-hmm.
in Liberia.
Yeah.
Specifically, we're going to be talking about the new Side Eye Center
Okay.
and how they're really transforming eye health in the country.
Right.
Um, we're going to be looking at the NSCC overview document
Okay.
for this deep dive.
Right.
And, what really stood out to me right away was the story of the founder, Robert Dolo, and how he left his job in Ghana
Oh,
to
wow.
go back to Liberia to address this need for eye care.
Yeah. That's really remarkable, isn't it? A real testament to his dedication.
It is, yeah. And so I think that's a great place to start.
Okay.
Let's go back to the beginning.
Right.
The New Side Eye Center was officially registered in 2009.
Mm-hmm.
But right off the bat, one partner that really stands out is the Seagal Family Foundation.
Oh, for sure.
I mean, they've been with New Sight for 11 years.
11 years? That's incredible.
It is.
That's more than just a one-time donation.
That's a real commitment, isn't it?
Absolutely. That's a partnership.
And it's not just about the length of time either.
No, it's about their approach.
How so?
Well, the Seagal Family Foundation, they're known for being pretty bold.
Bold.
Yeah. They really trust the organizations they work with.
That's got to be important, right? Giving organizations the freedom to do what they do best.
Exactly. They provide what's called non-restrictive funding.
Non-restrictive, what does that mean?
It means they give money for general administration.
So not tied to specific projects.
Right. So New Site can use the funds where they're needed most.
Makes sense. Gives them more flexibility.
Exactly. It's like, imagine trying to run an eye center when every dollar is earmarked for something specific.
Yeah, you'd be constantly juggling.
Exactly.
So this non-restrictive funding, it lets New Site adapt to challenges, address emerging needs.
It gives them ownership.
Ownership, yeah.
Ownership of their success.
I like that.
Hmm?
But their work actually began even earlier.
Yeah, so they started even before that with these free outreach programs
Oh, yeah.
in Montserrado County.
Okay.
And they were working with over 300 people in that first program,
Wow.
just operating, out of a two-bedroom apartment.
A two-bedroom apartment.
Yeah.
That's incredible.
Well, that's how they started.
And now they've grown into this incredible organization.
Yeah, they've really evolved to offer a comprehensive range of services.
So tell me about the scope of those services now.
Well, they provide medical and surgical outreaches. They have a full optical service, including pediatric care and surgical services for all kinds of conditions,
wow.
from cataracts to pediatric operations.
Okay.
They even handle emergency cases that are referred from other institutions.
It really sounds like they're equipped to handle almost anything.
Mm-hmm.
I was really intrigued when I read about the small incision sutureless cataract surgery.
Oh, yeah.
Can you explain what that is and how it's different?
Yeah, it's often called SICS for short.
Okay.
And it's a real game changer, especially in resource-limited settings.
How so?
Well, unlike traditional methods, which involve larger incisions and sutures,
Right.
SICS uses a much smaller incision,
Okay.
and that means faster healing, and it often eliminates the need for sutures altogether. So you can imagine that leads to shorter recovery times,
Right.
a reduced risk of complications.
Makes sense.
And that's especially important in areas where access to post-operative care may be limited.
Right. That makes a lot of sense.
Mm-hmm.
So it seems like they're really focused on providing care in a way that's really sustainable.
Yeah, and also meets the specific needs of the communities they serve.
Right. And I notice also that they've adopted subtenon anesthesia.
Right.
What are the advantages of using that technique?
Well, it's another example of how they're using these really innovative techniques to improve patient outcomes.
Okay.
So instead of injecting anesthesia directly into the eye, which can be, uncomfortable and even risky,
Right.
they inject it outside the eyeball.
Okay.
And this minimizes discomfort and risk
Right.
while allowing for a quicker recovery.
So they're committed to using all these really advanced techniques.
They are.
It's incredible.
It really speaks to their dedication to providing high-quality care.
Yeah. And they're also investing in training the next generation of eye care professionals through their ophthalmic training program.
Yes.
The document mentioned they've had 4 graduation ceremonies already.
It's remarkable, isn't it?
It is.
Well, establishing the program back in 2017 was a huge step towards, realizing Robert Dolo's vision of creating this sustainable system
Right.
for eye health in Liberia. The accreditation process involved benchmarking trips to the Gambia
Wow.
and South Africa,
Okay.
demonstrating their commitment to meeting these international standards.
Yeah.
And they've successfully trained and graduated a significant number of ophthalmic nurses who
Whoa.
are now contributing to eye care across the country.
That's incredible. And they're also doing this amazing community outreach program.
Yeah.
What makes their approach to reaching these underserved communities so effective?
Well, their community outreach program is extensive,
Right.
and it's very carefully planned.
All right.
They conduct regular medical and surgical outreaches
All right.
in both rural and urban areas,
Okay.
and they partner with local health centers to extend their reach.
I would imagine reaching these often remote communities would present a lot of logistical challenges.
You would think so, but they've developed a really effective strategy.
What's that?
Well, they work very closely with community leaders
Okay.
to identify the best locations for their screening.
So they're working with local partners, using these existing community spaces, and essentially bringing the eye care to the people.
Yeah, that's a great way to put it.
What kind of impact are we seeing from these initiatives?
Well, in terms of numbers, they've conducted a remarkable number of outreaches,
Okay.
both medical and surgical.
Uh-huh.
But the impact goes beyond just the numbers.
Right.
They've reached thousands of people who wouldn't have access to eye care otherwise.
Right.
And they're gathering valuable data
Okay.
on the prevalence of various eye conditions.
So they're not just treating people, they're gathering this data to inform future eye health initiatives.
Exactly.
That's impressive.
Yeah.
Let's talk about those numbers for a second. The overview mentioned some incredible figures.
Yeah, there's some big numbers.
What really stood out to you?
Well, they've performed over 6,848 cataract operations
Oh,
and over 9,000 eye operations in total.
that's amazing.
They've graduated 24 ophthalmic nurses,
Okay.
conducted 135 medical outreaches,
Uh,
and 76 surgical outreaches.
wow. And over 292,000 indirect beneficiaries.
Yeah.
That's really highlighting the ripple effect of their work. But I'm also curious about their focus on children.
Mm-hmm.
The document mentioned that they've screened and treated over 9,000 children.
Right. Early intervention for eye problems is so crucial.
Yeah.
And their work in this area is really commendable.
Yeah, it's not just about addressing existing conditions, but preventing future problems as well.
Exactly.
They seem to be taking a very holistic approach to eye health in Liberia.
They are.
But they're not stopping there, are they?
No, they're not. Their work extends beyond their main facility and outreach programs.
One that I found really interesting was the Liberian Government Hospital in Buchanan.
Right. Grand Bassa County.
Yeah.
Mm-hmm.
And I remember reading about establishing a secondary eye center there.
Right.
Can you tell me a little about that project?
Yeah, so back in 2014,
Sorry.
Robert Dolo and his team put together this proposal for a secondary eye center in Buchanan.
Okay.
They recognized the need for expanded services in that region,
Mm-hmm.
but they didn't go it alone.
Right.
They reached out to the Lions Clubs of Liberia.
The Lions Clubs.
Yeah.
I've always admired their dedication to vision care.
Me too.
Did they manage to secure funding?
They did.
Yep.
In August 2016, they received a grant
Wow.
of over US $400,000
That's
to
incredible.
make this secondary eye center a reality.
That's a substantial amount of money.
It is.
So what's the status of the project now?
Well, the project has been ongoing for 5 years,
Okay.
and it's nearing completion.
Wow.
The plan is to officially hand over the center to the Liberian Government Hospital Management Team. Okay.
By the end of 2024.
So they're essentially building this center and then handing over the reins to ensure its sustainability.
Right. It's a brilliant strategy.
It is. And they're doing the same thing with the Jackson F. Doe Memorial Hospital Eye Center project.
Yes.
Tell me a little bit about that one.
Okay, so this project was launched in 2020,
Okay.
and they secured another grant from the Lions Clubs International Foundation.
This time for over US $455,000.
Okay.
The project is set to run for 3 years, and it's focused on expanding eye care services in Nimba County,
Okay.
following a similar model of capacity building
Okay.
and eventual handover to local authorities.
So they've managed to secure over US $855,000
It's remarkable.
in funding from the Lions Clubs International Foundation
It is.
alone.
Yeah, they've clearly demonstrated their ability to attract significant funding
Mhm.
for these initiatives,
Right.
which really speaks volumes about the trust and confidence they've built
Yep.
within the international community.
So we're seeing a clear pattern here.
Yes.
Strategic partnerships
Mm-hmm.
ambitious projects,
Right.
and this unwavering dedication to creating lasting solutions
Yeah.
for eye health in Liberia.
You've summed it up perfectly.
It all stems from the passion and dedication of Robert Dolo and his incredible team.
It really does.
Their work goes beyond just building this infrastructure and
Mhm.
providing these medical services. What about that long-term impact on the communities they serve?
Well, their impact extends far beyond just the number of patients treated or the number of professionals trained.
Uh-huh.
They're creating this ripple effect throughout these communities.
What does that ripple effect look like?
Oh. For starters, by training these local professionals,
Yeah.
they're ensuring that these communities have access to skilled eye care providers
Mm-hmm.
in the long term.
Okay.
This reduces reliance on outside aid
Right.
and creates the sense of ownership and empowerment
Makes sense.
within the community.
So they're not just providing a service.
Right.
They're fostering self-sufficiency and sustainability
hmm
in eye healthcare.
And by improving eye health,
Okay.
they're indirectly impacting other areas of life.
Oh, okay.
Well, people who can see clearly
Right.
are more likely to participate fully in their communities,
Okay.
contribute to the economy, and lead healthier lives overall.
It's amazing how something as fundamental as eye health can have such a profound impact
It really is.
on the social and economic well-being
hmm
of a community.
It's like a chain reaction of positive change.
Yeah, it is. What are some of the key takeaways that other organizations can learn
That's a great
from the
question.
New Sight Eye Center's model?
I think one of the biggest takeaways is the importance of building those strong partnerships.
Okay.
It is, and it's a good segue to our next partner, actually.
Okay, who's that?
Rotary Clubs International Foundation.
Look. Oh,
Local Rotary clubs in the U.S. partner with the foundation.
so it's a joint effort.
Right, and
Yeah.
that collaboration really amplifies the impact.
Interesting. So you've got local communities getting involved.
Exactly, and speaking of local, the Syncor Rotary Club, they've been really involved as well.
Syncor, that's in Liberia, right?
Yeah, right near the new Sight Eye Center.
Oh, Rotary. Yeah, I know they do a lot of good work around the world.
They do, and they were actually there at the very beginning with New Sight
The beginning, like when?
back in 2010.
Wow, so they helped to get the whole thing off the ground.
They did. They provided essential equipment.
That early support, it can make or break a new organization, can't it?
Absolutely. It's like a vote of confidence.
Yeah, like saying, we believe in you.
And now let's talk about a partner with a really specific focus.
Okay, I'm intrigued.
Samaritan's Purse.
Samaritan's Purse. Yeah, I know them. They do a lot of work in disaster relief.
They do, but they also have a big focus on global health.
Interesting.
And with New Sight, their goal is pretty clear. Breaking down barriers to eye health.
Breaking down barriers, that's a powerful image.
It is. And Samaritan's Purse, they're not just offering a single solution.
No. What do?
They take a comprehensive approach,
Comprehensive meaning.
meaning they provide both medical and surgical interventions.
So they're covering all the bases.
They are, and get this, they don't just work directly with New Sight.
Oh, really?
Yeah.
Who else are they working with?
They're also collaborating with Liberia's Ministry of Health.
Wow, that's big.
It is, and even county health offices.
So they're creating this whole network.
Exactly, a network that extends deep into those rural communities.
And this time, we're headed to Gabarnga, Liberia.
Sounds intriguing. What's caught your eye there?
Well, I've been digging into some documents about this eye clinic, the new Sight Eye Center in Gabarnga. And I gotta say, what they've managed to pull off in just a year is pretty remarkable.
A year? That's not a lot of time to get something like that up and running, especially in a place like Barnga. I'm all ears. What's the story?
So the document we have here is just a snippet, really, a few paragraphs, but it paints a pretty clear picture. The clinic is the result of a partnership between the Segal Family Foundation and Pamadzi Philanthropy Advisors.
Now, those are two names that carry some weight in the development world. What's interesting is how different their approaches are.
Right. The Segal Family Foundation, they're all about empowering local communities, right? Sustainable, ground-up solutions.
Exactly. And then you have Pamadzi, who are known for their expertise in building healthcare systems. Strong track record there. This partnership, it's like they've found this sweet spot, combining the best of both worlds.
And it seems to be working. The document says the clinic is operating smoothly. Which, I mean, think about it, a brand new clinic in a region where resources could be stretched thin, that's no small feat.
Absolutely. They've demonstrated the power of collaboration by working closely with organizations like the Lions Clubs, local health centers, and community leaders.
It seems like partnerships are at the heart of everything they do.
They really are.
It's not about doing it all themselves,
Yeah.
but leveraging the strengths and resources of others to
Exactly.
achieve a common goal.
And another key takeaway is their focus on sustainability.
Mm,
They've consistently demonstrated a commitment to building systems that can continue to thrive
okay.
even after their direct involvement ends.
Right.
This is evident in their approach to training local professionals
Right.
and handing over projects to local authorities.
It's a really sustainable model for development.
It is.
Instead of creating dependency, they're empowering these communities to take ownership of their own well-being. Do they have any systems in place to gather stories or testimonials
They
of
do.
the people whose lives they've touched?
They regularly collect patient stories
Wow.
and testimonials,
That's great.
which provide powerful anecdotes,
Yeah.
but also offer valuable insights into the real-world impact of their work.
Those stories must be incredible.
They are.
It's one thing to see the numbers, but
Mm-hmm.
to hear firsthand how their work has transformed lives.
It's a reminder that behind every statistic is a human being
Yeah.
whose life has been changed for the better.
It seems like they've created a truly remarkable model
They have.
for sustainable development in healthcare.
It's really inspiring.
We've been talking about all this incredible work that the new Sinai Center is doing in Liberia and how they're really transforming eye health in the country.
Yeah, it's been an amazing journey so far.
It has, and one of the things that really stood out to me was their commitment to staying at the forefront of all these advancements in eye care,
Mm-hmm.
even in this, resource-limited setting.
Absolutely. And these partnerships have not only provided access to this cutting-edge equipment,
Okay.
but also facilitated knowledge transfer and skill development.
That's fantastic.
They've even set up a simulation lab where ophthalmic nurses can practice these techniques
Uh-huh.
in a safe and controlled environment
Gotcha.
before applying them in real-life settings.
What are some of the challenges that they face
Right.
in incorporating these advanced techniques?
Well, you're right. Maintaining equipment in a setting like Liberia can be really tough.
Yeah.
But they've implemented a very stringent maintenance schedule,
Okay.
and they've trained their staff to perform basic repairs and troubleshooting
Oh, okay. So they're handling it on site.
as much as possible.
Yeah.
That makes sense. They've also established relationships with suppliers
Yeah.
to ensure a consistent supply of those essential consumables.
Right. And how do they stay updated with the latest advancements?
Well, they regularly send their staff
Just-
to international conferences
Oh.
or workshops.
Okay.
They also subscribe to leading medical journals and online resources.
So it sounds like they've created a really sustainable model
It is.
for integrating all this advanced eye care
Mm-hmm.
into a resource-limited setting.
It's not just about acquiring the technology,
Oh,
but
Russ.
building the systems and the expertise to maintain it
Yeah.
and utilize it effectively.
And I think that brings us to the impact of all these efforts.
Mm-hmm.
We've talked about the numbers, the surgeries, the professionals trained, the outreaches conducted.
Right.
But what does it all mean for the people of Liberia?
It's a profound impact.
Yeah.
For individuals who have had their sight restored through surgery
Mm-hmm.
or received treatment for eye conditions,
Yeah.
it's a life-altering experience.
Okay, so, have you ever thought about what it would be like to struggle in school? Not because you're not smart, but because you literally can't see what's on the board. Or even, read your textbook.
I mean, it's kind of hard to even imagine, right?
The new Side Eye Center's School Eye Health program. And we're going to figure out, why it's making such a big difference.
Sounds good.
So this whole thing got me thinking, about how easy it is to overlook something as basic as vision.
Yeah.
And the World Health Organization, they put out this statistic that just blew my mind. Almost 15% of school-aged kids in Liberia have some kind of visual impairment that they're not getting treated for.
Wow.
It's a huge EE number, and it makes you realize, no wonder there are issues with education and opportunity there,
For sure, for sure. And I think what's, even more concerning is that there are some regions in Liberia, like Nimba, Grand Bassa, and Painesville City, that have absolutely no school eye screening programs.
Right. That's a huge gap.
It is.
And I was thinking about the long-term consequences, right? You've got these kids, they're struggling to keep up in class, maybe they end up dropping out, and then, their choices for the future become super limited.
Yeah, no, absolutely. It's a snowball effect, right?
Oh, boy.
Uncorrected vision, it impacts, way more than just their schoolwork. Their confidence takes a hit, their social life,
It's got to be rough.
It really is.
So that's where the new Side Eye Center comes in. And they're doing some seriously cool stuff. They've partnered with Pamoja Philanthropy Advisors, and this collaboration is making a real difference.
Oh, yeah, it's a great partnership.
It is. What's Pomoja's role in all this?
Well, they're basically the strategy folks. They're all about impact. They bring a ton of experience to the table.
Right.
And they work really closely with New Site to make sure that the programs are actually, achieving what they set out to do.
So they're making sure the resources are used well?
Exactly, and that things are sustainable, for the long haul.
Makes sense. Like there was this one story about a girl named Nanaya.
Oh, yeah, Nanaya's story is incredible.
It is. She lived for 9 years struggling to see. Can you imagine? And she was told she was too young for glasses.
It's heartbreaking, honestly. How do you even tell a kid that?
Right. It's like denying them a basic necessity. But thankfully, New Sight came along, and she finally got a pair of glasses through their program.
Yep, and it totally changed her life.
It's amazing, right? Like, she's participating in class, her grades are going up, and you can just imagine how much her confidence must have grown.
Oh, absolutely, night and day.
And I think that's what makes this program so powerful. It's not just about giving someone better vision. It's about unlocking their potential and giving them a chance to really thrive.
It's about breaking down those barriers that are holding them back.
Exactly.
Empowering them to succeed.
The New Sight Eye Center's journey is a testament to the power of human ingenuity,
Absolutely.
a compassion and determination to make a lasting difference in the world.
Couldn't have said it better myself.
And it makes me think, what can we, in our own spheres of influence, do to support organizations like this, or even initiate positive change in our own communities?
It's definitely something to think about.
It is. Until our next deep dive,
Yes.
keep exploring, keep learning, and keep making a difference.